Hi friends, I am here again with another case note explanation. If you are watching my channel first time, please subscribe, like and share it. And please try to watch the whole video without skipping, otherwise you won't get clear picture about this letter. So let's watch the video. Today I am going to discuss about another case note. So let's see about who is the receiver. So first it is mentioned the hospital name, the Royal Adelaide Hospital. Then patient details are given. So it's very important to read the subheadings at the left side. So it will give you, it will guide you, and you will see what all information you have to include in this letter. So if you miss something, it can cause to lose the mark in your exam. So be careful and always read completely, and use the 5 minutes which is given at the beginning. Use it effectively so you can get the full mark during examination. So let's see the patient details. Name Mr.Robert. Date of birth is given 2nd June 52. Then marital status married. Next to kin is wife. So admission date is given 1st October 2011. Then discharge date is given 26 November 2011. Then reason for admission: chronic cough, hoarseness, difficulty breathing upon exertion. So what is the diagnosis? Squamous cell carcinoma of left lung confirmed by CT scan. Then let's move on to the past medical history. HT means hypertension. So it's very important to know about the abbreviations. I have done one video before, just try to watch it so you will get clear picture of the abbreviations, so you know the meaning when you do the case note. So hypertension was diagnosed on June 2008. Then frequent episodes of bronchitis. He is a heavy smoker for 40 years. He daily smoke 1 to 1.5 packs per day, but non-drinker. Then just was the social history. He is a lawyer and his wife is very supportive. He has 2 married daughters in regular contact. One is 6 months pregnant. Then medical progress. So resection of the lung. Then chemotherapy and radiotherapy has done, but the treatment is ineffective. It's an ineffective treatment. Metastasis in liver and spine already. Then cancer in terminal stages already, and Mr. Jones wishes to return home. Then the nursing management is what all things has done. Fluid management was given, then oxygen therapy, and patient became comfortable. Then pain management, morphine sulfate 40 mg for hourly. Then total of 20 mg dose as needed. And discharge plan is given: monitor pain status, manage symptoms, check need for assistance with mobility and bathing. Daughters want father to stay in hospital for further treatment. Then provide family with the emotional support. So that is the recommendations given in the discharge plan. So let's see who is the receiver. Writing task: using the information given in case notes, write a letter to Mary Watson, Palliative Care Manager, Royal District Nursing Service, about the patient. So you have to inform to the palliative care manager about this patient's condition and what all the recommendations. So first, when we get the case note, what you have to check, first read the information what given, then just go to the writing task which is given here using the information given in the case notes. Write a letter to and what all things have to include. So let's see what all information we have to inform this receiver. So we got a clear picture when he was admitted and he discharged. But when you are writing on your exam, don't worry about the discharge date because that will be the exam date. So here we can use this date because it is this exam was conducted on 26 November 2011. So then reason for admission we have to mention to him, and then diagnosis. And as it is a palliative care manager, he should know about the cancer and the history also. If it is related to, if he has to know, we have to inform. So let's see how we can write this letter. So the address name is Mary Watson, palliative care manager. We should put the position Royal District Nursing Service. Then the discharge date is the date we have to write. Always try to leave a line in between so it will give a clear picture for the examiner to read. So 26 November 2011. Then we have to put the salutation. Dear Mrs. Watson, because we always use surname. Then don't forget to put the comma. Then the reference. Mr. Robert, comma. Here the date of birth only given, so we can write that one. DOB, the same like then colon, then 2nd June 1952, or we can write like this also 02/06/52. Then how we can write an introduction? So we are referring this patient to the palliative care manager. So we can write I am writing to refer, or we can say I am writing to introduce. First time we are introducing this patient to him. So we can write like that. I am writing to introduce Mr. Robert, then comma. Then so what is the condition of this patient? So we can write who has been diagnosed with the terminal stage of lung cancer. Because it's mentioned in cancer in terminal stages already. So the palliative care manager once read this introduction, he got a clear picture why we are writing. Comma, then what is the requirement? So he requests who has been diagnosed with the terminal stage of lung cancer, comma, requires pain management, and what is the, here it's mentioned pain, monitor pain status minus symptoms. So we can pain management, then supportive care because he need assistance with mobility, bathing like this. So we can put as a supportive care following his discharge today. Or we can write also he requires support care and full stop, then he is being discharged today, or after his discharge today, like that we can write several forms, but the meaning should be clear for the, and the purpose also clear for the receiver. Then we can write in the second paragraph the current conditions, how he was admitted, like that. So Mr. Robert was hospitalized on, so what was the date? 1st October 2011. So what was the complaints? With chronic cough, hoarseness and breathlessness. If this difficulty breathing upon exertion, we can write breathlessness. Then what he is in. So how it was confirmed by CT scan. So his CT scan revealed, what revealed? Squamous cell carcinoma of left lung, or in the left lung we can write. It's better to avoid the repetition. So if we write of the left lung, or if you wrote the squamous cell carcinoma in the introduction, don't write it again. So we can write confirm the diagnosis, like that we can write. Then what he has done? So consequently, otherwise, therefore, like that. Because in order to get a flow, we have to use some connectives, like that. So consequently, comma, the lung resection was performed, followed by chemotherapy and radiotherapy, which is ineffective. So until now we explain what all things, how he was admitted, then what all, how it was confirmed the diagnosis, then what all things was done. So the resection of the lungs was done and followed by chemotherapy and radiotherapy, but it was ineffective. So I will do a video later, the difference between following by and followed by. It's totally different. So we have to make sure what we are writing. Otherwise, there is a chance to lose the mark. Then what is? So, comma, therefore, comma, he was noticed with the metastasis in the liver and spine because the treatment was ineffective. So he was noticed with the metastasis in the liver and spine. So the admission details has completed. Then we can tell what is happened during hospitalization. During hospitalization, comma, he was also treated with the morphine sulfate 40 mg for hourly. Then what else we have given? Intravenous fluid and oxygen therapy. Then what is his condition? Currently he is stable and comfortable. Don't use the term patient. Always he or use the name. Never use patient. Even though they put in the question, when we are writing the letter, never use patient. So then we can write the social history and medical history. So Mr. Robert lives with his wife, and it is mentioned here supportive wife. So we can write who is very supportive and has 2 daughters. No need to mention he has pregnant daughter, like that. Just mention daughter. So because the family, he has to provide the emotional support for the family also. That's why we have to mention about the family. Otherwise we can omit that one. Then he has had hypertension since June 2008. Because this is curable and also it's continuing. It's not finished. This action is not finished. That's why we are using has had since June 2008. Then what all things? We finish until the management and the pain management also finished. So what is left? Only the discharge plan. That means the recommendations. So what are the recommendations? Upon discharge, or in view of the above, considering the above, like that we can write. So we can use upon discharge, comma, it would be greatly appreciated if you could provide palliative care for Mr. Robert, because we used already the supportive care and pain management, like that. So never use again the same word. Always use different synonyms or words so you won't lose the mark. And always try to be empathetic and also use polite words when you are writing recommendation. Don't feel like that it is a command or order. Always be humble and just use please, kindly, like that. So then please monitor his pain status and manage symptomatically. Then what is the other recommendation? Kindly check the requirements of assistance in mobility and bathing also. Then please provide. We can use another word for the synonym for provide, render, like that. So please render emotional support for Mr. Robert's family. Then the conclusion word we can write the sentence. Please do not hesitate to contact me if you have any queries regarding Mr. Robert. So as the name of the receiver is given, always use yours sincerely and make sure the Y is capital and S is small letter and comma. Then leave a line. After that you can write what's your position. Start registration. If it is mentioned charge nurse, head nurse, like that, you have to write head nurse or charge nurse. Otherwise you can write registered nurse. Or if your name is given, you have to write the name as well. So I think it's clear for you, and just try to do another example so you will get more information, and also it will be easy for you when you will get in the exam. Okay, thank you for your support and thank you very much. Bye.